the knees when she is supine. Not under the ankles, under the knees. So we come under the knees, under the sheet, and then we lift the client's knees for them. And just slide the bolster under. Are you comfortable?
Yeah.
And then I always just touch right here just because I want them to know that this is where I mean. Is this comfortable? All right. I haven't done a massage in so long, y'all. COVID is a mess. All right, so how do we open up the massage? We on here. How we open it? Just tell me.
Can you take two breaths for me, please?
That is so. Now it's on Mariah.
Oh, because you left. It's all right. Talk.
Yeah. Sorry.
Can you take
Focus
a couple
on.
of deep breaths?
All right, and then now as she takes her deep breaths, we're gonna place our hands on her, right?
Yes.
Cool, wonderful. All right, so I'm gonna have you take a couple of deep breaths. And remember, while they're breathing, you should be breathing with them. And also applying a little bit of pressure with your breathing. Come on, why you ain't telling me? Is this out of order?
If it's still on Mariah, tell her to move over here by you.
Come on.
Yeah, I told you it's weird.
Okay, come over here.
Is it following
And a
me?
hater. Now
Is it really
following
following me?
Mariah.
That's crazy.
And it's on danger. That is crazy.
It's around. Use the video she took.
I know, but
Yeah,
like,
you gotta stand in it for a couple seconds and it'll
That's
pick
great.
you up. Stand there. Let it pick you up.
me, please, me,
Mhm.
not them.
Now come back.
This needs like a remote or something.
It does. It's all right. It's fine. That's why I said I wanted to see what it's doing because it's really dumb.
All right, well, you can hear me. All right. And if you would like, you can start with full body compressions. Pressure, okay?
Mhm.
And during these full body compressions, what are we checking for? What's the point of the compressions?
To feel where we're going to work.
Yeah, feel where you feel tightness at, right? All of this is tight.
Mhm. Everything's tight right
Mhm. And you see how I'm just not doing one compression and then moving on. Like, I want this to really feel like a hug. What time is it?
9:39.
And I'm gonna go right to the top of the hip. Right where I feel the bone at. That's where I wanna be. Please don't start in the middle of the hip. It's so incomplete. Pressure still good? Why do I check in with pressure?
To
Deja?
make sure.
See how much pressure you should have to.
He pulls it over.
3-hour dance a thon yesterday.
Like, I want her to be so excited for this massage after I finish with these compressions that she's like, oh, yes. But then, with that also, the massage has to be great, right? You can't just give a good hug. Like, you can't do that. The massage has to be awesome. Remember to compress the feet too, both sides, top and the bottom. And we're always using the correct body mechanics. Now, I know that this may take some time. Like, you know, this is a long process, just compressing. But it feels good. And I told you, I've had clients just ask for compression sessions.
Really?
Yeah, they just want me to compress them.
For how long?
The whole session, the whole 60 minutes.
Are you
Wow.
serious?
Yeah.
So you just spent 60
I
minutes.
didn't do it, but
Oh.
I asked for it. Because I was younger then. I was like, that's dumb. What?
Yeah, I don't want to
But
do that.
now, I would do it.
Mm.
You just open
Cause
up
it's so
each area
easy.
and compress again.
Can't you just do like a 30-minute session though, like
No.
shorten it?
No. You know how long I could actually sit here?
Oh,
and like
oh,
compress
okay.
her
Well then,
muscles?
if you put it like
If I
that.
sat here for long enough and just let her fascia, like when I show y'all how to move stuff out of an area, if I just sat here and just let her fascia do the work and be patient, this takes patience to just sit like this on both parts. Like something still would happen under my hand.
Would it really address like all of the deep problems as well?
Yeah, because I'm working through the tissues. I'm still peeling the onion. It's just slower.
Gotcha.
Also, compress, I can use my forearm. And this helps to cover a greater area. How's the pressure? And then as I sit here, maybe I feel her tissues release, I can go in a little deeper. But I want to make sure that I feel that release first before I just go all in. Both sides. Feel all the stuff she got going on over here. So now, her whole body is tight. Am I gonna be able to get through everything in one session? No, not at all. But I'm still remembering all of this for my soap notes. So when I do my soap notes, I'm writing out down all of this stuff so that I have a I don't know, an idea of what needs to be worked later on. And then I can give her a treatment plan for later on. This is being recorded, so this might be enough. Hey, David, no, I want you to move. And look, and I say that this supposed to be 30 minutes, but oh, shit. We'll see. Get a stool or something to sit down.
Oh yeah, I was like,
The tiptoe over there, like bend down, nobody can't see you. Yeah, there. It's on me now. So now I start with, let's say catcall or something like that. Y'all see my nails, right? Don't go to work like this, y'all. And when I'm here over the joint, I'm not giving a lot of pressure because it'll hurt. Because now I'm at the bone. So when I come up to the muscle, now I can start to give more pressure. And remember, we're moving our bodies. Why? Because it's a dance, not a stance. And then I start just warming her up so that her neck knows that she's about to receive work. And again, still palpating to see if one side is tighter than the other. So for her, I feel like the left might be just a little bit more stiff than the right. Just a little. So now I'm just gonna turn her head. And I'm not gonna start out with lotion yet. Okay. And I still like